This is John Fauber, and this is a special report from the Milwaukee Journal Sentinel and MedPage Today. This report deals with physicians at major academic centers in the United States, as well as with a leading maker of medical devices. But a crucial element of the story is Tomislav Smoljanovic, an orthopedic surgeon from Croatia, who has raised questions about the safety of a biological agent and who has refused to be dissuaded by either power or prestige.
Doctor, let me just first of all ask you a little bit about your practice in Zagreb. What kinds of patients do you see? What kind of surgeries do you do?
Well, I'm an employee of the Department of Orthopedic Surgery here at the University Hospital Center Zagreb and the School of Medicine Zagreb University. This is the oldest orthopedic surgery department in Croatia. We have been founded more than 100 years ago. We deal with all kinds of pathology within the orthopedic surgery. Me personally, I usually mostly perform operations on lower limbs, meaning total hip and knees arthroplasties, arthroscopies, and other procedures. And occasionally I do procedures on upper limbs. Personally, I do not perform spinal surgeries, but some of my colleagues do that as well.
So how did you get interested in this product, which is known as bone morphogenetic protein 2 or Infuse? How did you get interested in it, and how did you, why did you start trying to create awareness about serious side effects with the product?
Back in summer of 2006, when I was a young resident at this department, my mentor, he gave me a task to analyze published articles related to clinical use of bone morphogenetic proteins. Then I performed a thorough review of the literature, and I have observed that some adverse effects of that device, bone morphogenetic protein 2 in particular, occur in spinal interbody fusions based on the way how the device was applied to spinal surgery during the surgery. And I approached to my other mentor, who was my mentor for bone morphogenetic protein, but at the time he told me that my findings were irrelevant. So because he told me so, and I was very young, I didn't continue at that time in that research. But later, when I succeeded to change the thesis of my PhD, I made my PhD on rowing injuries. We did one big research about rowing injuries among international rowers. And then I was able to continue my further research in the area of adverse effects of bone morphogenetic proteins without any supervision. And we have found out that several adverse effects were at least ignored in some published papers.
I want to ask you about that, because the one that the Stanford researchers are publishing about now is a serious side effect that causes sterility in men. And you have been trying to get a couple of the leading journals, medical journals in the United States, to publish letters that you've written about this, raising concerns. And I think, correct me if I'm wrong here, but I think what you're saying is that the data that was submitted to the FDA about this product, BMP2 or Infuse, showed that there was a higher rate of this particular side effect, which is known as retrograde ejaculation. But that when the doctors who did the study got around to writing published articles about the product, they never mentioned that that BMP2 or Infuse was linked to this side effect that causes sterility in their published research. Is that correct?
You are completely right. Retrograde ejaculation is one serious side effect of bone morphogenetic protein used during anterior lumbar interbody fusion, EA, during the labeled use of infused bone graft. In papers published from that seminal study, which gained FDA approval for the device, there is no correlation between bone morphogenetic protein and that serious adverse effects which cause sterility in male patients. It is interesting that each item provided in that studies, each item which was analyzed was compared between investigational and control group. Only retrograde ejaculation was not compared between those two groups. And that was something that drew our attention, and which then put us in research of FDA data, and we found out in FDA data, the data that has not been published in medical professional literature, that from that study, 13 male patients had retrograde ejaculation, and only 12 of them were from BMP group, and only one was from the control group.
The other thing I wanted to ask you about is that you have an interesting career. Prior to becoming an orthopedic surgeon, you were a world-class rower. If I'm not mistaken, I think you won a bronze medal at the 2000 Sydney Olympics. Is that correct? And in a team rowing event. I just wonder if you could talk a little about your rowing career, and also, you know, you seem to have shown a lot of tenacity, a lot of willingness to stick with this quest that you've had to alert doctors about the potential side effects from this product. And I'm just wondering whether that kind of dedication and determination is something that you also needed to be a world-class rower.
Well, anybody who is involved in rowing or who has ever been involved in rowing knows that rowing is very strenuous activity, and that the rower has to be very persistent and very reliable, and that the rowers have to pass through huge pain during the last 500 meters of the race. And in those situations, a person really build up his own character, and the rowers are known by the fact that they don't leave unfinished jobs. I had hundreds of races, and some of them were really hard and very painful, but I have never ever stopped before the end of race. So I'm used to finish my jobs when I start to do that. And when I started to analyze this literature, and when I found the irregularities, I decided to clear them to the end. So I think that we are in good way to clear all irregularities related to the use of infused bone graft.
Great. Well, listen, Doctor, thank you very much for your time, and good luck in your future research endeavors.
Thank you very much for your invitation.
Okay, great. Thanks.